following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I am being joined by Dr. Jared Chapman from Living Well, and our special guest, Heather Ellis. Many of you may remember we started following Heather's journey a few weeks ago, and we're going to continue that journey today. And today we're going to focus on the lower half of the face. Correct, Dr. Chapman?
Yes, so we call it lower face rejuvenation, or, chins are in. And if you go out and do any research on the internet and you're pulling things up, Allergan just got an indication for the chin using Vollure. And so it's big right now to focus on the lower face as the continuing part of the rejuvenation. We've had a lot of focus on the mid-face, and we've shown that on the air a couple of weeks ago when we worked on cheeks. But just to complete our process, we're going to add a little bit of volume to this area right in here. And a lot of women come in complaining of, they call it the marionette line, or they have this deep sulcus here. And they'll really start noticing that the saliva actually pools in the corner of the lips, and they start getting a irritation there. And sometimes that's an indication that they have severe volume loss in that area. But we can go in with a simple, tiny little needle, and I'm going to have Heather lay back here for me. And we've numbed her prior to, and also already cleaned her before coming on the air. Normally that's a process that takes about 2 to 3 minutes. And we're ready to begin this. We do this with a cannula, which is a separate type of device that allows to minimize bruising in this area. Also allows for only having to stick the patient one time with a needle. And as Heather can attest to, that this feels just a little stingy, but otherwise she's not feeling much of anything at this point. I always say when I come across to the chin area, I'm using a little bit of Vollure actually in this area, because we just want to soften this ever so slightly in her, because she doesn't have that much volume loss.
Okay.
But this is an area that when we treat this and then we treat the lips, we can really see a dramatic change, and that's how simple that is. That took me less than 30 seconds to correct that area.
How do you feel, Heather?
That was easy.
Good.
Yeah.
Good.
So it's a very simple technique, and if you look, when she's actually lifting her chin up now, you can actually see a softening of this area as compared to this area. Just a slight difference. We're not wanting something super dramatic. We're going to finish her lips today as well. We'll do that off air, but we're going to add just a little bit of volume to her lips. And then when we follow up with Heather in about 2 weeks, we're going to get back with you, and we're going to show the entire journey being completed. This process takes about 20 to 25 minutes when someone comes into the office. Once we determine what we're going to do, the treatment really takes about 20 to 25 minutes for me to completely do everything. The patient leaves, can go straight to wherever their grocery store of choice is, or if they have to do any other shopping, or just go home and rest for the evening. But there's little to no downtime with these procedures, and there's minimal bruising now with these procedures. So it truly is, we refer to it as the liquid facelift. It truly, or the lunchtime facelift, it truly can be done on a lunch break, or a break in the afternoon. The patient can return to work with little to no change from any type of bruising or redness or swelling at this point.
But if you can guarantee me that I'll look like Heather when I leave, then sign me up now. So
Heather is beautiful inside and out. She's one of those patients that just radiate beauty. So we're so thankful that she's allowed us to film this and share with the public that, aesthetic medicine doesn't have to be scary. It doesn't have to be for only those who have, a lot of wealth. It is for anyone. It can fit anyone's budget, and it can fit anyone in any stage of life. It's just, they need an experienced injector to work with that really will take them through the journey.